Lauren Rogers-Sirin, an Associate Professor of Psychology at the College of Staten Island, joins us now live. Thanks very much for your time there. Now, firstly, how do you view this new hotline opposed to other initiatives like insurance and access to sufficient mental health services?
Well, I think it's an excellent step. It's not going to manage all the problems that we're having in mental health, but it destigmatizes the idea of feeling suicidal. Mental health is as common and important a type of pain as any other type of pain, and yet it's very stigmatized. So having a 3-digit number makes it simpler. When you're in a crisis, it's hard to think through many steps. The easier the process is, the better it'll be for people who are in a crisis. And then having a national number, I think, also communicates to people that this is a problem that lots of people experience, that you're not alone. And so that we as a society decided to set up a system to take care of people who are in crisis. And I think that's a good message. I do think, however, that once you reach out for help, the help needs to improve. Access to quality health care is limited. And I think that the more money you have, the more good health care you have access to, and that's wrong.
Some analysis describes the US as currently going through a mental health crisis. The numbers are staggering. More than 45,000 people killed themselves in 2016 and more than 1.4 attempted suicide. What would you say is behind this increased trend?
Well, I think it's probably a number of factors, not just one thing. But we do live in stressful times, and there's a lot going on that kids are worrying about that we didn't have to worry about before. So I think kids in particular are carrying around more stress than maybe other generations. And I also think that despite the fact that we know that mental health is a situation that everyone is going to deal with at some point in their life, there still is stigma around it, and that makes it difficult for people to reach out. And I think at the core of the problem, the biggest contributor is an unwillingness to fund proper mental health for everyone who needs it.
Is it possible, though, that these such incredible numbers can be compared to other Western countries in the sense that perhaps the mental illness level is the same, or the issues of mental illness, yet the access to guns is different? So here in the US, perhaps the accessibility to, quote unquote, an easy way out is there, opposed to other Western countries where there is a strict gun control.
Absolutely, and I'm really glad you brought that up, because that is definitely a contributor, and the facts are very clear. When people make suicide attempts with other means, they're less likely to succeed. If you make a suicide attempt with a gun, you are likely to succeed. And suicide attempts are often made impulsively. And so access to guns definitely increases the crisis of suicidal attempts and successes.
Okay, we'll leave it there for the time being. Really appreciate your time on the show today.